Please proceed.
Thank you, John, and allow me first to congratulate you for bringing the UN Group of Friends to action finally. My great regard to Professor Harvey Alter and Professor Michael Houghton and all the esteemed colleagues and distinguished guests in your side. I'm very happy to join you today, and I apologize for not being able to be with you in person due to unscheduled urgent commitments. It's a pleasure to witness the launch of the UN Group of Friends for Hepatitis Elimination, which is considered a global health problem threatening the health of nearly 350 million people living with this silent disease. Egypt recognized early on the gravity of the disease impact on the lives of its victims, as well as the gravity of the lack of medicine and appropriate diagnostic tools. The formation of this group is a glimmer of hope for expediting international efforts to eliminate the disease in order to achieve the Sustainable Development Goals and the goals of the World Health Organization 2030. Egypt, on the basis of its long experience in combating the disease, invites all interested countries and international stakeholders to join this important group, which will undoubtedly represent an important starting point in the international efforts to combat that disease. Egypt expressed the full support to the group of friends and the opportunity to lead the effort for the first year. And finally, allow me to share with you some slides describing the Egyptian success story in hepatitis C elimination. Well, can you see my share slide now?
Yes.
Okay.
Yes, we can. Please proceed.
Perfect. As regards to the first slide, Egypt adopted a list of countries which was the highest in prevalence of hepatitis C based on the data came from the DHS in 2008. The HCV antibody prevalence was 15%, while those who were viremic reached to 10% among the age group 15 to 59. In 2015, the following DHS showed a decline in HCV antibody prevalence, which went to 10% and declining the viremic patient to the level of 7%. Some of the age group, this decline was attributed to the decline of IPC measures and the existence of highly affected group being more than 60 years old. And if we look at the size of the population in both surveys, it was assumed that we had nearly 5 million HCV viremic cases in 2008 and almost 4.1 million viremic cases in 2015. And the important modeling study was one of the best studies that guided the national strategy decision in 2014 based on 3 scenarios. The first one, which is the base case shown on the black line on top, assumed that there were low efficacy drugs, low number of treated patients, and no measures whatsoever to reduce the incidence. In that scenario, we would reach the year to 2030 with more than 4 million HCV cases. While going to the second scenario, which is the blue line, assume that if we increase the treatment efficacy and the number of treated people with no measures to reduce the incidence, in that scenario, we would reach the year 2030 with more than 1 million HCV. On the other hand, if we look at the third scenario, which is the green line, assuming that if we increase treatment efficacy and the number of treated people with the adoption of the measures to reduce the incidence, in that scenario, we would reach year 2030 with a few thousands, only a few thousands of HCV cases. Egypt has passed through a long way in fighting hepatitis C with a very comprehensive strategic action in front of you, including a substantial package of prevention, awareness, with the adoption of blood and injection safety policies and promoting people's awareness towards the hepatitis C problem and burden. Egypt succeeded in diagnosis and treatment of more than 4.5 million cases through expansion of testing activities and the proper linkage to care for evaluation and treatment on the government expenses, which is very important. We also succeeded in offering the HCV brand medication with only 1% global price. And I repeat, only 1% of its global price. Then totally shifted to depend on the national national capacities to locally produce the generic drug, which enabled the expansion of the treatment coverage and deployment of treatment services. The story is completed with a strong network of sentinel and surveillance sites which allowed for proper monitoring to incidence and mortality indicators. 5 key pillars are considered landmarks and milestones and also achievements that paved the way towards hepatitis C elimination in Egypt. First, the robust political web, which is very important, which allows prioritizing the hepatitis C problem in Egypt and was also able to mobilize enormous resources for HCV battle and strengthen the national action, many laws and regulations. The presence of strong infrastructure allowed to absorb millions of cases through well-equipped viral hepatitis treatment centers, supported with a robust chain of diagnostic capacities, and all of these are packaged with a huge pharma industry sector which was capable of manufacturing millions of doses in a very short time and with high-quality medicines. And I know that some of those heroes are joining you live at your premises now, John. Egypt is always guided by national integrated, multi-sectorial plans of action and frequently conducted surveys to follow and assess its progress. And we also succeeded in utilizing of nearly 60,000 healthcare workers to perform the 100 million Health Life presidential initiatives aiming and priority for hepatitis C elimination in 2018. They were able to do screening, assessment, and treatment of cases at different levels of action. And finally, at our decision, we're guided by holistic research and answered many questions and helped to reach the best strategy and performance. Egypt was on date with a real disaster, with an expected disease burden between 2015 and 2030 that would reach the national expenditure of nearly 89 billion US dollars, and Delhi reached 7.8 million years. If we kept the same pace of management with low efficacy medication and low number of treated people, and no efforts to reduce the incidence, which is very important. But Egypt decided to jump to success and achieved at 2022 a cost saving of 1.4 billion US dollars and 1.1 million life years saved through adopting the mass screening and offering the high efficacy medication to discovered cases. Finally, it is my pleasure to conclude that Egypt is on the path of elimination through the achievement of almost all the WHO indicators for HCV elimination. And we are ready to help all the countries that suffers from hepatitis burden to reach all to the 2030 elimination target. And I thank you very much.
Thank you.